Hello, everyone, and welcome to Tech2's Science Podcast, the Earth, Space, and the Human Race. I'm Kavya,
And I'm Abigail.
and today we're going to talk about breast cancer, why regular checkups are important, and we're also going to bust a few myths around the disease itself. And bringing her 14 years of experience in the field of breast cancer as a surgeon and a researcher is Dr. Rucha Kaushik. She's a breast cancer surgeon with Hinduja Hospital in Bombay, and she specializes in breast reconstruction surgery. So thank you so much for making your time and joining us today, Dr. Rucha.
Let's jump into the questions right now. So, Rucha, with over 1.6 lakh new breast cancer cases being reported each year in India, and breast cancer is one of the most common type of cancer that women in India are facing. How often do women in general should get themselves checked?
Okay, so it depends on the age because breast cancer, getting chance of, the risk of breast cancer increases with increasing age. So after the age of 40, all women should get themselves checked by an expert annually. That is once in a year. And after the age of 50, you can get your mammography or sonography along with a clinical checkup by an expert. Unless you have risk factor, you should not worry about getting breast cancer. If you have high risk factors, then you should be more vigilant and visiting doctor more often for regular checkups.
Also, we think of breast cancer as something that is mostly or only something that concerns women. But men also succumb to it, right? And in America, especially, there are a lot of statistics, recent statistics that show at least 1% of all the breast cancer patients are men. And is it a kind of
Yes.
similar ratio between men and women in India also, where breast cancer is concerned? Yeah, please.
98% of breast cancer they occur in women and 1 to 2% occur in men. So when we see the lifetime risk, 1 in 28 women, 1 out of 28 women will have lifetime risk of developing breast cancer. Same if we see in men, 1 in 800 men. So it is very rare, but yes, breast cancer can occur in men.
And does it affect men and women differently? I mean, women, of course, have biologically a lot more breast tissue, and they probably have a lot of hormonal side effects as well because it is also related to reproductive functioning, I guess. How does it affect the
Yes.
two genders
Yes.
differently? Can you tell us a little bit about that
I
as well?
think emotionally it affects equally to both gender, irrespective of gender. Getting a cancer is a really, at emotional level, men and women both they get disturbed. But the treatment part is exactly same, like diagnosis. Treatment depends on the stage of the breast cancer. So we don't treat gender, we treat cancer. Yes, definitely hormone treatment and all we need to consider in women, that if women are in reproductive age group of, or if they have not completed their family, so before starting treatment we need to think about ovarian preservation. So all these things we need to consider in women, but the treatment part is exactly the same and it depends on the stage of the cancer.
And you also said that it's quite difficult for breast cancer patients, no matter which gender they belong to. Do you have any advice for them since you have seen a lot of
Yeah,
patients
so
come?
yes. So first of all, nowadays we have newer advanced treatment where women they don't have to undergo mastectomy, where we do breast conservation surgery. We remove the lump and address few lymph nodes in the armpit, and we can save breast as it is. Mastectomy is required in a very small number of patients. So, if they come forward, we diagnose it early, if detected early and treated early, it is completely curable without losing your body image. And those who need to undergo mastectomy, we can do immediate reconstructive and plastic procedure. So, that fear of going out of hospital with flat chest is not there. So, we don't send them like that. So we try to do and give the best possible cosmesis and then send patient home.
So now that you were talking about mastectomy, that a lot of people think about Angelina Jolie. Like she was one of the first people who spoke about, having her breast tissues removed because she was genetically at risk. So, but there are still a lot of like misconceptions and like a lot of unknowns around the whole mastectomy procedure. And like you said, it's not necessary anymore. Like it's not a thing that somebody has to do. Can you talk a little
Yes.
bit more about the procedure and like, what are some of the risks that people might face if they do opt for this kind of a surgery?
Okay, so mastectomy is a complete removal of breast tissue along with lymph node dissection in the armpit. It is usually done where conservation is not feasible. Nowadays, 75 to 80% of our breast cancer patients where we are able to offer them conservation, and those in whom we are unable to offer conservation where mastectomy needs to be done, we usually offer the reconstructive and plastic procedure along with mastectomy so that that trauma, fear of losing body image should not be there. So mastectomy, one should not be scared if doctor tells you that you are the candidate for mastectomy and not for conservation, because there are options available to get reconstructive and plastic procedure done in the same sitting or later as well. And many women, they can wear external prosthesis if they don't want to undergo reconstructive procedure. Then there are silicone prostheses which can be wearable within the bra pocket, and then they can use it whenever they want to.
So you mentioned like conservation procedures. What does that really mean?
Okay, so conservation procedure is removing the lump. Breast cancer usually presents as a painless hard lump. So if that lump is small and if patient is presenting early or detected early, then we can just remove that lump along with clear tissue margin and checking the armpit node, which is a first station or first site of spread. If tumor decides to go outside the breast and spreading to rest of body, it has to cross that barrier of that side of armpit. So we have to address armpit node, which is called as a sentinel node biopsy, which is the first node of affected from breast cancer. So usually patient will have a small scar on the breast, and we usually do closure from within. So superficial, if you look, there is a very thin line scar, and in armpit also there is a thin line scar. So practically after completion of treatment, radiation and everything, after few years, even patients are unable to see the scar. So that is the biggest advantage. But considering all this, we have to, I mean, choose the right candidate for breast conservation. It's not that every patient will fit into, but mostly if they present early, it is we can offer conservation.
And just like a quick takeaway, if we are looking to do like a self test, where in the breast is it most likely that the lump will actually show? Like which part of the chest or underarm?
Okay. So
Is there?
ideally, it's a upper outer quadrant of the breast. If we divide the breast tissue into inner quadrant and outer quadrant, drawing a line from clavicle, midline of the clavicle. So it is usually upper outer quadrant, which is close to the armpit, but it can occur anywhere. So what we suggest that once in a month on the 6th or 7th day of your menstrual cycle, we should get our self examination, that is a breast self examination in the mirror, by inspection, by visualizing whether both breasts are equal, any lump or any fullness in any part of the breast, or by palpation method like checking with your hands, so with flat of fingers. For that, you need to know how your normal breast feels. Then only you will be able to find any abnormality. So anything abnormal, painless, hard lump, you should take opinion of doctor.
Going to on a different scale, on the national level, as a country, do we have enough facilities to kind of look at testing enough number of people, maybe spreading awareness, uh, giving information about centers that are open to looking for breast cancer, or even in cities, does the average woman have enough facilities around her to get tested and treated for breast cancer?
Yes, definitely. I think India has the best breast cancer or whatever cancer treatment facilities available across all big cities with specialists attached to, like, it's a multidisciplinary treatment. Any cancer needs multidisciplinary approach. Like you need a surgeon, you need medical oncologist, you need radiation oncologist, you need radiologist, post-operative care taken by physiotherapists. So it's a group of people or group of doctor, a specialized doctor will take care of that patient. And I think in India, most of the cities have very good dedicated cancer centers. In Mumbai, definitely we have. And I think, yes, people can reach to any specialist in 1 or 2 days, unlike Western countries where they need to wait for 3 to 6 months to reach to a particular specialist. So I think in India we have a very good medical setup and medical facilities easily available and at affordable cost.
Like you mentioned, that we do have a good medical specialist support center for people who do have breast cancer. After they go through the entire process, is there anything else that they need? Maybe not just medical support, but like any other kind of support that they would need to deal with this, the whole, like the kind of
I,
trauma that you would
I
go through once you have any other kind of cancer. So what other kind of processes or some support will people need?
So I think first is family and your close friends. They are the one who are going to support you. But unfortunately, in India, because of social taboos and social norms, many women, they don't share their problem in the family or to friends, that how people are going to treat me after getting diagnosed as a cancer, and they keep it to yourself or just to their spouse, and they struggle throughout the treatment due to lack of family support or friend support. So what I always try to tell my patient, that at least you should share your emotional experience or what you're going through with your close family and close friends circle, so that they are there to give you that emotional support which you need throughout the treatment. Of course, every patient is entitled to have best treatment option available medically, but at the same time, they should have such kind of support in family as well as friends. So I think about the social taboos, if we can do something and take out that fear or that scare of how people will treat me after cancer, if we can take out that, it will be helpful. And yes, definitely there are multiple breast cancer support groups where patient can go meet other cancer patients, share their experience, and I mean talk their heart out.
That's good to know, right? I mean, if you have the ecosystem and the support to at least access,
Yes,
you know,
and it
get the attention
affects
when it's.
on patient psyche a lot. I mean, now it's almost 15 years I'm seeing. So we can give them maximum or best possible treatment option available, and we can talk to them, listen to them, compassion, everything. But at home, they are, I mean, they are going to need someone. Doctor can't be there with 24/7. We are call away, but uh, for emotional support and at home they need someone. So that needs to be, that is a very important part, I feel. It helps
Is there
patient to
also
recover fast.
yeah, yeah, definitely. And is it also a financial strain on families to kind of have one or two breast cancer? I mean, generally, I mean, if your family, someone in the family has breast cancer, then you know what it is like on an emotional level. But also, I think the expenses of taking care of any illness these days is very high. Is breast cancer one of those, expensive
Uh,
diseases
no, I
that?
would not say, unless there are particular types of breast cancer which needs targeted therapy or some special form of chemotherapy. Those only patient may have to, I mean, if not finances are, they might struggle, but there are multiple social organization, charitable trust, which are
Yeah.
there to help you. So I think no, breast cancer is treatment is not that expensive unless you need some targeted or some more advanced treatment, which is for a very small group of patients.
So, now that we're talking about how you treat it, how do you treat breast cancer? Is there some way that you can prevent it? Like, is there some kind of precautions that you can take to prevent yourself from getting breast cancer in the first place?
Yeah,
Or
so
lifestyle
pre
choices. I mean, that's the
yes.
other thing. We
So
have a lot of myths.
so exact cause of breast cancer is not known. All the risk factors we know. What we know is a high risk factors. So in high risk factors, there are modifiable, which you can modify, and few are non-modifiable, like age, gender. These are not modifiable. Like being a woman, you are at risk. Increasing age, you are going to be at risk. So those who are which are non-modifiable risk factors, we cannot change. But the modifiable one, where you can maintain healthy weight, you can have healthy and active lifestyle, saying no to junk food, saying big no to alcohol and smoking, and getting yourself checked on regular basis. So if you take care of all these things, I think you can reduce your risk of getting breast cancer in future.
So like we know, like, and like you've said as well, there are a lot of myths, a lot of taboos surrounding breast cancer. So we're gonna send you a couple of questions, and you just need to tell us yes, no. Okay. So the first one
Okay.
is, a lot of mothers and grandmothers will tell you not to sleep with a bra on because that will cause cancer. Is that true?
No, not true. It's a
Okay.
myth.
Um, Using whitening creams or an underarm antiperspirant will cause cancer.
Myth.
Okay. If it's a lump on the boob, it's cancer.
No, not all lumps in the breast are cancerous. 9 out of 10 may not be cancer, depending on your age and risk factor.
Okay. Once you go into remission with breast cancer, it won't return.
No, there is no 100% guarantee that it won't return. Again, it depends on the stage of your diagnosis and how you responded to treatment.
Breast cancer only occurs in women of a certain age who are much older, and younger women are kind of spared from it.
No, it's not like that, though it's very rare and very small percentage in younger women, but it's not like that any age is spared.
Okay. If you have the BRCA gene, you will most definitely get breast cancer.
Not necessarily.
if you get a boob job, you will get cancer.
No, myth
Um,
again.
breastfeeding can reduce the risk of getting breast cancer.
Yes, this is true. So
So
breastfeeding
it's good to
reduces the risk of,
breastfeed your kid.
yes, it's good to breastfeed. It's good to have kids before 30 and breastfeeding them.
Question, rapid fire question. Uh, is it true that if you do not get pregnant, you are more at risk of getting breast cancer in your 50s or 60s?
Yeah, because then you don't breastfeed your baby because you won't be having babies, you won't be breastfeeding, and then breast cells they don't become mature enough. So what we call it as a nulliparity, like not having kids is called as a nulliparity, which increases the risk of getting because the few cells they remain immature. So then
Mhm.
they can turn into cancerous cell in future, but not it's not true for each and every woman who don't have kids. Okay.
Okay.
So, last question is keeping your phone in your breast pocket will cause breast cancer because of radiation for both men and women.
But why would you want to keep it in breast pocket? No one should keep it in breast pocket because there is no proven data, but maybe in future there are multiple studies going on about radiation and breast cancer, radiation tower and distance, that how long you're staying away from tower and what is your risk. So I think maybe one should carry a nice sling bag or something to carry on the bike.
So,
Yeah.
prevention is better than the whole person, the
Yes.
cure. Okay.
Hmm.
So that's it for our rapid fire. Thank you so much for,
Yes, well
helping us
played.
out. For people who have gone through breast cancer or who, who haven't, is there kind of like an advice or something that you would like to say to all our audiences?
Yeah, so I just want to tell that breast cancer is completely curable if diagnosed and treated early. So do not ignore any recent onset change in the breast. If you find any lump which is not usual for you or it is not related with your menstrual cycle, it is hard in consistency, so you must visit your doctor and get yourself checked. And don't get scared if you have lump because not all lumps in the breast are breast cancer. Many young women they will have benign kind of fibroadenomas in the breast and they can also present with breast lump. So get yourself checked. Do not ignore any lump, but at the same time, do not feel scared because if it is diagnosed early, we can treat and completely cure it.
Thank you so much for joining us and like giving us these tips, and also all your advice was really helpful, especially during breast cancer awareness month. Like
Yeah.
even though this month is kind of dedicated for it, we need to be vigilant throughout the year, not just in October. So thank you so much for that.
Yes. Yeah, that should be the message from your podcast that it's not only October month. Every month is important and we need to take care of ourselves
Yeah.
every
Okay,
time.
Yeah.
thank you.
Okay.
Men and women,
I,
Yes.
everyone,
yes,
people everywhere.
everyone. Everyone.
Yeah. Okay.
Okay.
Thank you so
Have a
much,
great
Dr.
day.
Rucha. It was lovely
Thank
speaking to you.
you. Take care.
Bye.
Yes.
Bye. Bye.
All right. That was it for this week's podcast. Join us next week where we will be discussing whether citizen driven campaigns can influence India's larger climate policy. If you have any questions for our experts, send them over to us and we will ask them. Until then, this is Abigail and Kavya signing off. Catch us next week where the Earth, Space, and the Human Race podcast. Bye.